I am glad to be here in Dallas. This is where I grew up. I was born here and went to Richardson High School, and then I went to Brigham Young University, where I got a Bachelor of Science in Biology. And then I went to John Bastyr College of Naturopathic Medicine in Seattle, Washington, where I received a doctorate of naturopathic medicine. And for those of you who don't know, that is a general practice family medicine that specializes in natural therapy. So I treat everything from colic in newborn babies to congestive heart failure in older folks, and I just use natural medicines. It's actually more powerful than I thought naturopathic medicine would be when I got involved and introduced to begin with. I had thought mainly it was, and I would help marathon runners run faster times. And I found that the body's the real healer. It's not doctors, it's not drugs. And the body has that inherent healing ability, and it's phenomenal. And there are elements in nature that we can use that help to stimulate that inherent healing ability. And the body responds dramatically and many times much faster than with conventional drugs, which oftentimes suppress. So I went to get my doctorate in Seattle, and there are only 3 schools of naturopathic medicine in the country. We started a 3rd school 2 years ago in Scottsdale. I'm one of the co-founders of the Southwest College of Naturopathic Medicine. We have our 3rd year class started this year. And so I keep pretty busy between a medical practice that is completely booked and receiving patients from all over the country, as well as one of my loves as a doctor is really being a teacher. That's what doctor means in the Latin. It means teacher, and most doctors don't have the time to teach. If you go to a doctor's office and you get 5 minutes and you get to say 2 or 3, introductory "how are yous," that's about all you get to say. And we need more time than that to express what's really going on. We need doctors who can look at the whole perspective, and that's what holistic medicine is all about. That's what naturopathic medicine is all about, getting at the underlying cause of disease and then treating that as naturally as possible. And the body has that ability. We simply need to recognize what it's telling us, and we need to enhance its inherent systems for healing. So when I went to medical school, I learned about clinical nutritional prescribing, as well as botanical or herbal medicines, homeopathic medicines, spinal manipulation, as well as acupuncture. And these are all what make up naturopathic medicine. So we really combine, I think, the best of all worlds, using modern technology and diagnostic criteria, as well as the natural therapeutic regimes. And so it's been exciting to me to be involved, and you see now almost every week, at least every month, on the front page, some information about a nutritional breakthrough, things we've been using for 100 years that are called a breakthrough, because finally we do a double-blind clinical trial to prove what we've been using for over 100 years or longer. But it's becoming well known. And it's about time, because the body's the real healer, as I keep saying. And when I was in medical school, I had not heard of the grapeseed extract. It was unknown to me, and this shows you a little bit about our state of learning here in the United States, because this is something that has been used as a pharmaceutical preparation in France since 1949. So it's been around a long time. And I graduated in 1986. And at that point I had heard of, we had studied bioflavonoids and used bioflavonoids. This is a bioflavonoid, and the most potent one that we know of. Grapeseed extract has been found to be a potent antioxidant, and we'll talk about this when I show some slides in just a minute. It's been found to be 20 times more potent than vitamin C and 50 times more potent than vitamin E. And antioxidants have recently gotten front page press on Newsweek and USA Today newspapers because of their therapeutic benefits in so many realms of medicine. And interest is really phenomenal, because we're finding that we need antioxidants to protect our bodies from the ravages of modern lifestyle. And we are facing chronic degenerative diseases in this country that are the number 1, 2, and 3 killers, and the number 6 is also in there. Heart disease, number 1, cancer number 2, strokes number 3, diabetes number 6. These are all chronic degenerative diseases, and one of the main causations is oxidation in our body, caused by free radicals, which are in our environment as pollutants, and also come from the air that we breathe, simple process in our body. But because we have so much pollution and so many toxins in our environment that we are breathing, eating, ingesting, that we use up all our antioxidant vitamin C, E, and beta-carotene, and we need more than we can consume. So we need to take supplements to really combat this lifestyle. Many people ask me, well, can't you just get it from foods? They used to. Well, they used to didn't have so much pollution. If we could all go away, and you have to go way far in Dallas to get this far away, somewhere where you can find soil where there's land, which you can afford, you could grow your own crops in soil that was nutrient rich, you could probably do without, because you'd be far enough away that maybe you wouldn't have to inhale the pollution of automobiles. But we live in a rush pace, polluted environment, and when that happens, we have a lot of free radicals that are in these pollutants. And these cause damage throughout our body that can lead to not only heart disease, strokes, cancer, diabetes, but also arthritis, cataracts, glaucoma, and a lot of other chronic illnesses. So it wasn't until a couple of years ago that I learned about grapeseed extract. And with all the thousands and thousands of herbs in the world, I was surprised that I didn't know about this. And I was amazed to find out how powerful this was. And so I want to show you a little slide presentation to tell you about this. Grapeseed extract is rich in bioflavonoids. Now, bioflavonoids are synergistic elements that work with vitamin C to strengthen the body and to help prevent illness. We need bioflavonoids. They originally were discovered and thought to be a vitamin themselves because they are so important. Vitamins, however, mean they're necessary in small amounts, and we have to get them from our diet. And really, they should be called vitamins, and they used to be called vitamin P. There's a lot of them. There's at least 2,000 different bioflavonoids. And the bioflavonoid in grapeseed extract is proanthocyanidin. And this is, in my opinion, the most potent preventive medicine we can take. It's probably the most significant nutritional discovery of the century, and perhaps the most significant discovery of medicine in the century. And that's saying a lot. And it's not a panacea. It won't cure everything, but it is amazing for its therapeutic range of benefits. There are several names for this bioflavonoid. Leucoanthocyanin, pycnogenol, procyanidin are some of the synonyms, and somehow over the years I've become good at remembering strange long names. So you don't have to remember these. We try to make it easy. Grapeseed extract is all you have to remember, and we try to get back to the basics. A simple thing like grapeseed. And if you'd all go home and rush to your grocery stores and get some grapes, you'd be helping yourselves a lot. But if you go to your grocery store, can you find grapes with seeds in them? We have seedless grapes now, don't we? A few years ago, because of our palate, scientists unwittingly figured out a way to make seedless grapes, because we didn't like these hard things in the middle of this luscious, sweet grape. But we should be eating that whole grape, seeds and all. It takes about 4,000 grape seeds to create one capsule of grapeseed extract in a 50 milligram capsule. And we throw those seeds away in the past. Now we've figured out they're so helpful that we have made an extraction process to recapsulate them. And we need more of them than you could eat in a day. There are a lot of different sources of this same bioflavonoid. Grapeseed is the most concentrated. Pine bark is also one of the most important sources. And it's in actually the bark of the tree. It's also in the pine needles, the pine tree leaves. It's also in the skins of grapes. It's also in every fruit you see that has that cyan color, hence the name proanthocyanidin, the deep purple, bluish coloration. So blueberries, plums, even dark cherries, cranberries. And the purple coloration is actually what is the bioflavonoid, proanthocyanidin. Okay, it's also in hazelnut leaves and lemon tree bark, And one I didn't put up there is peanuts, which aren't purple at all, but there's a little bit of proanthocyanidin in peanuts, and the reason I mention that is because that's the first one that was discovered by Professor Jacques Masquier, a French researcher who's doing his doctoral thesis on bioflavonoids, and discovered that the bioflavonoid in peanuts could strengthen the blood vessels in laboratory animals and double their strength within 1 hour of administration. And hence, a year later, a French pharmaceutical company exploited this information and made a drug from the bioflavonoid extracted from peanuts. So proanthocyanidin have amazed me because of their wide range of therapeutic benefits and uses. First of all, it's an antioxidant. It is, as I mentioned, 20 times more potent than C and 50 times more potent than E. And that's saying a lot. We've recently learned, and this is in medical journals throughout the world, and MDs are standing up and taking a look at this because vitamin E has been shown to reduce heart disease by 47%. Now, this is important. This is the #1 cause of death in this country. And if a natural substance can reduce the risk of dying from a heart attack by 47%, that's significant. Because we also recently learned that the calcium channel blocking drugs, which are the #1, 4, and I think 6 selling drugs in this country, multi-billion-dollar drugs, actually increase the risk of dying from heart disease by 60%. These are drugs that are prescribed to reduce blood pressure, actually increase the risk of dying from heart disease by 60%. These drugs are still on the market. There was a study just 2 months ago that showed this, and there's no big recall on all these drugs. They don't know what else to do at this point, so they're hoping this study is wrong, and they're waiting until somebody else does another one to confirm it before maybe they think about taking these drugs off the market. They're not a cure. The body's the healer. These bioflavonoids actually get incorporated into the body. When you eat grapes, skins, seeds, and all these other fruits, they get incorporated into your body tissue and strengthen the blood vessels, and therefore prevent the hardening of the arteries that leads to increased blood pressure, that eventually leads to plaque buildup, that eventually leads to death of heart tissue, which we call a heart attack or myocardial infarction. And the antioxidant effect is one of the benefits. It protects the cholesterol in the body from becoming oxidized, which then adheres to the walls of the arteries. Cholesterol in itself is not bad. We need cholesterol to produce hormones. None of us would be here without cholesterol. It's impossible. We produce some of the female hormones that create the regular cycle and fertility. If we didn't have cholesterol, and we get this idea that we don't want any cholesterol, what we don't want is oxidized cholesterol. When you have oxygen, free radical molecules in your body that aren't being tempered by the enzymes in the body that the body produces to prevent that oxidation, when you don't have enough vitamin C, you don't have enough vitamin E, then you get oxidized cholesterol. And that causes plaque to build up in your arteries, narrows the arteries until you get high blood pressure, and eventually clots that cause stroke or heart death. Not only is it an antioxidant, and that also will help to prevent many other illnesses, which we'll talk about. But it's also anti-inflammatory, it's anti-allergic, anti-mutagenic, and it stabilizes the connective tissue, collagen and elastin. And the connective tissue are the tissue that connect everything in your body. Collagen is the most abundant protein in your body, and it holds everything together. The skin, the blood vessels, your joints, all the mucous membranes. So it's throughout the body, and that's why it has such wide range of effects. Because when you eat grape seeds and grape skins, the bioflavonoid proanthocyanidin is absorbed and distributed throughout the body, and has been shown in laboratory animals to be absorbed and distributed within 1 hour. This is probably the most bioavailable nutrient that I know of. It's water soluble, it gets into the body quickly, and it even crosses the blood-brain barrier. Now the blood has a barrier that protects the brain from a lot of things in our diet. Even vitamin C can't get across, vitamin E can't get across. Now vitamin C is converted into a form called dehydroascorbic acid, which does get into the brain, but not vitamin C. The bioflavonoid proanthocyanidin does, and we're waiting on studies to confirm this, but we're seeing effective results even in Alzheimer's, because some of that is related to oxidation of brain cells and death of brain cells in the gray matter, and this helps to prevent that. So it gets throughout the body, and everywhere you have connective tissue, it's going to benefit. So let's look at some of the uses. The first is probably the most talked about, but it's not the first one that was discovered. The oxidative prevention, or prevention of oxidation, or its antioxidant effect, is the one that's getting most of the press and interest, as we've recently learned how important antioxidants are in preventing disease. But Jacques Mascuier discovered, first of all, that it strengthens blood vessels. And so in France, for at least 45 years, it's been used to strengthen the blood vessels and to protect the blood vessels from damage, and especially diabetic retinopathy, for example. In diabetes, the high blood sugar actually oxidizes the lining of the blood vessels and causes damage to the eyes, and patients with diabetes usually go blind. Their legs become gangrenous because of poor circulation, and oftentimes they end up with amputated limbs because of this oxidant blood sugar that's too high in their body. And we've found that the grapeseed extract not only protects the body from the damages of the blood sugar, but actually reduces the blood sugar. We've had patients tell us that after starting to use this, the pain in their legs from poor circulation went away, and the discoloration of their legs went away, and their blood sugar went down. And this was something I didn't know. We are still learning amazing things about this bioflavonoid. We knew it would protect the oxidant effects, but we didn't know that it would actually reduce blood sugar. Easy bruising, varicose veins, hemorrhoids. Some of my patients, as I prescribed this for other things, started to tell me of their story, how all of a sudden their varicose veins were going away. We prescribed it maybe for arthritis. It's anti-inflammatory effect, and their varicose veins went away. Someone that had hemorrhoids, their hemorrhoids went away. And the most amazing thing, 88-year-old woman, as I would watch her, and she hadn't even noticed it herself, but her daughter had, her brown spots, the typical age spots, went away or were going away. And this is some of the amazing things that we are seeing. And really, the aging process is perhaps nothing more than a deficiency of bioflavonoids. Many of the signs of aging, the age spots, arthritis, wrinkling of the skin, varicose veins, these are what we typically call signs of old age, may be a sign of bioflavonoid deficiency. The improvement of platelet stickiness, this was determined a long time ago. The platelets are the blood cells that prevent you from bleeding all over the place. When you have a little scar, platelets form together and block the arteries. But if they get sticky because they get oxidized, then they don't slide through the blood vessels, and they block the blood vessels, and a clump of them together will cause a stroke. So that's one of the ways it reduces the risk of stroke. Bleeding gums is another one. Let me tell you a story how this was discovered. Jacques Mascuier was studying with peanuts. He found that bioflavonoid strengthened the blood vessels. And in between 1949 sometime and 1951, he read an account of Jacques Cartier, who with his crew in 1534 sailed up the Gulf of St. Lawrence in Canada to explore the area. It was winter, it was November. A bad snowstorm locked them into the Gulf. 4 feet of ice, 5 feet of snow up to the decks of the ship. They were close to shore. It was covered with ice. They walked to shore, but they didn't have any food. They were in an area where they couldn't gather any fruits and vegetables. They had hardtack and dried biscuits, and that was all they had from November until April. And they subsisted on that, but they started developing the typical symptoms of what we call scurvy. They call the dreaded sickness, where they became weak, their muscles began to ache, their joints began to ache, their gums began to bleed, they began to bruise easily. These are all the signs of scurvy, and they didn't know what to do about it. 25 of 70 crewmen died. Jacques Cartier was distraught. He didn't know what to do, when they would get out. It was April. They didn't know when the ice would melt enough that they could get out and get to somewhere where he thought maybe he could get some medical help for these crewmen. But he saw a Quebec Indian, a Gaia, who had been sick with a similar illness 2 weeks prior. And now he was running and looked vigorous and strong, and he asked, "What on earth did you do?" And they communicated with him, and the Indian showed him where to procure the pine needles and bark of a pine tree that grows in the area, and from that make a tea. They boiled the bark and the pine needles in water until it made a thickly concentrated extract from the bark. And he took that back to his crew, and only one of them were courageous enough to drink it. This one said he would do anything. He tried it. It tasted bitter, but he kept drinking it. And within a few days, he began to regain his strength. And within 2 weeks, he was completely healed of all of the symptoms of scurvy. And by that time, all the rest of the crew members were clamoring and fighting each other to get this tea. And the rest of them survived. So Jacques Mascoyer in France found that the pine trees that grew in the southern region of France also contained this bioflavonoid. So in 1951, he patented an extraction process from the pine bark. And that was then exploited and made into a drug. But they couldn't test it very well, because pine trees grow 20 feet tall and it takes 20 years to grow them to maturity to get enough pine bioflavonoids to produce an effective product. And so he was continually working for 19 years to find other resources. He found in 1970 that grape seeds also contain this bioflavonoid, the purple grapes that they have growing in France. And so he patented an extraction process made from grape seeds and found this to be 10% more highly concentrated than the pine bark in the active bioflavonoid proanthocyanidin. He then found that not only was it a more concentrated source, but he could study it. And he could grow the grapevines in a laboratory setting and infuse it with carbon dioxide that was labeled with carbon-14. And then these grapes labeled with carbon-14 would be eaten by laboratory animals or fed to laboratory animals. And then they could find out how fast it was absorbed, where it went, and all the therapeutic benefits, and do testing to make sure it was safe, and test high doses to make sure it was not harmful in any way. So over the next few years, until 1976, this was vigorously studied, and a drug was made, approved by France's equivalent of the FDA, found to be free of any teratogenic effect, meaning free of any harmful effects that would harm a baby fetus that was growing within a pregnant woman, free of any illness that would be caused around a birth, free of any cancer-causing effects, and totally harmless at any level. They went up to equivalent of 132 pounds of this per day, and found that it would still cause no problems. 132 milligrams per pound, of body weight, which is about like taking 8 bottles a day, which nobody can swallow that many in a day. They just stopped testing at that point because there was no sense in testing higher. They knew that no one would take more than that. And this is a food. This is grape seeds. This is recognized as safe in this country, if you can find them, to eat in your grocery store. But then they started using this in France for, again, the blood vessel diseases, and found that the patients were reporting how powerful this was for so many other uses. They found out that it was also good for inflammation, edema, swelling. Patients who had swelling of their ankles said their swelling began to go away. And in my practice, I've seen some significant illnesses, patients who had severe swelling of their ankles for various reasons. That could be from a sprain or strain or trauma, and the swelling will be reduced. Not only the swelling, but the pain, because swelling causes pain. Also, allergies. They found out that this would cure their allergies. They would have seasonal inhalant allergies, and they would start taking this maybe as prescribed by their doctor for their blood vessel strengthening, and their allergies would clear up. I've had patients tell me that I had one person come into my office who does our payroll, set us up for a new account, and she says, "Okay, I don't know anything about what you do, but I've got allergies. Cure me." So, well, it's not exactly what we do. We'd like to maybe talk to you more and get more information, but you can get some grapeseed extract. That's one of the things I use, and that'll help you. And I knew it would work for her. And she came back in a week with our records, and she said, it's incredible. My allergies were gone in one day, and I was using Seldane and Dristan and everything else, and nothing was working. And she had a drippy nose everywhere she went. And as a salesperson, that was not good for her. And these kind of stories we hear all the time. Briefly, a story about inflammation. I spoke to a Rotary Club in Scottsdale, and there were a lot of gentlemen there who liked to play golf but couldn't play anymore because of arthritis. And one gentleman came up afterwards. His hands were so crippled he could hardly shake my hand, deformed because of rheumatoid arthritis, and bent and weak. He says, "Can this help my hands?" And I said, "Yes, it will help your hands. Take 2 capsules twice a day." And he said the next day his pain was totally gone in his hands, which he'd had for 15 years. He was currently taking cortisone and methotrexate, 2 of the most toxic drugs that we have that are effective usually, but in his case he was still in pain. They suppress the body's immune system. That decreases the inflammation and the allergies. There's a natural way to do that. And one of them is the grapeseed extract. There are other anti-inflammatory and anti-allergic bioflavonoids and other nutrients that we use, but none of them is as potent as the grapeseed extract, or with as dramatic effects. He was totally amazed and had already stopped or cut back on his use of cortisone and was about to stop using methotrexate, which will make him live longer for that reason only. But we've also found that it probably will extend our lives and the quality of our life. We know recently a study last year showed that vitamin C can extend life. There was a study of 11,000 men who were taking somewhere between 300 and 400 milligrams of vitamin C per day, and vitamin C by itself was shown to reduce overall death rate by 42% and reduce the risk of heart disease by 45% and extend life in men by 6 years. And proanthocyanidin, grapeseed extract bioflavonoids, are 20 times more potent than vitamin C as an antioxidant. Long list of extra uses, more uses. People are amazed when they hear these stories and they go, how can this be? Actually, as a doctor, I was skeptical when I first started hearing anecdotal experiences of people. But I've seen and heard them enough in my practice to know why, and as I've studied it, I found out why. And that's one of the reasons I'm here to tell you more so you can understand why this happens. This list seems long, and it's impressive. And I want to tell you a little bit about why. Stress ulcers, one of the most commonly prescribed drugs in America is for stress ulcers. We have a lot of stress in our environment. We live in a fast-paced city, and I never drive on a freeway, and almost never in Scottsdale. We have very few freeways, and they're in the other part of the city. And we've been on a freeway 3 or 4 times every day since I've been in Dallas, and lots of traffic. And that in itself is a lot of stress. Stress ulcers is a multi-billion-dollar drug industry in this country. And the bioflavonoids in grapeseed extract, we'll show you a slide in a second, actually protect the mucosal membrane. The connective tissue that holds the mucous membranes together gets incorporated with these bioflavonoids and actually protects them just like paint on a fence. When you paint a fence, you paint it for the aesthetic look and appeal of a color, but you also paint it to protect it from rust. Rust is nothing more than oxidation. And that same thing happens to our mucous membranes. It gets oxidized and will wear away, erode. And the grapeseed bioflavonoids will protect the body from that type of erosion. Periodontal disease. We have a dentist here. I've had a lot of patients tell me that they were amazed when they started taking this. They went back to their dentist. They'd have no more periodontal disease. The pockets that were beginning in their teeth that were 5, 6, 10 millimeters deep of plaque, and their gums were starting to recede, and their gums were bleeding easily, that all cleared up. So dentists should be excited to find out there is something for this, because there virtually is no treatment rather than scraping away the plaque and hoping you can keep it away. This works two ways. It strengthens the connective tissue of the gums. It's an antioxidant, so it prevents that oxidation. It also binds to the membranes around bacteria in the mouth and actually prevents bacteria from clumping together, which can cause damage to the gums and also cause cavities. And it's been found that it actually can reduce the incidence or frequency of cavities because it prevents the bacteria from clumping together and getting on top of the teeth and eroding the enamel. Liver protection. It's also been found as an antioxidant to protect the liver. The liver has to detoxify all these chemicals in our body, including drugs, environmental pollutants, even some of the chemicals that are in foods we eat and in hormones our body produces. Even estrogens have to be conjugated and broken down in the liver, and this helps to protect the liver from the oxidation that takes place in that process. Radiation protection. Cosmonauts in Russia have used bioflavonoids for years to protect them from radiation exposure flying in outer space, in the upper stratosphere. And they were told after Chernobyl to drink Crimean red wine because of the high bioflavonoid content. And for years it's been found that French seem to have lower incidence of heart disease, and people who drink wine said, aha, there's my excuse. It's because they're drinking wine that they have this protection, and there's something in the wine, and therefore I'm going to drink wine. But now we found out somebody who was smart and wanted to trick them did a study with grape juice. We found out the grape juice will do the same thing. So it's not the alcohol, it's the grapes. And it's not the wine at all. We should be eating the grapes or unfermented, non-alcoholic grape juice. Wrinkles of the skin and cellulite. I'm going to show you a slide in just a minute. This is thinning of the skin, thinning of the connective tissue. When you leave lawn furniture outside, what happens to it? It gets brittle and hard and wrinkles up, doesn't it? Our skin is exposed to the sunlight, and that is radiation. And that is oxidation that takes place in our skin. And elastin and collagen make up the connective tissue in our skin. And the grapeseed extract actually binds to the collagen and elastin and protects it as an antioxidant from this oxidation and will prevent wrinkles. I've had even patients with scars call me and tell me I was afraid or embarrassed in the past to wear a two-piece bathing suit because I have a surgical scar across my abdomen. And do you know the scar has reduced so much that it's almost not noticeable now? Cellulite often is thought of as simply a cosmetic thing, or maybe something that's vain. What it actually is a sign of bioflavonoid deficiencies. If you have cellulite, you don't have enough bioflavonoids in your body. And maybe you're not exercising quite enough. I can't take everything in a pill. I have to eat right and reduce the amount of fat consumption, but also exercise and take bioflavonoids. Benign prostate enlargement. This is another thing that's amazed me. I didn't know it worked for prostate enlargement, but it works as an anti-inflammatory, antioxidant, and we're not sure why else it might work. But I, for years, used the berries from the saw palmetto tree or bush. And that is pretty effective, and we found that this proanthocyanidin bioflavonoids from grape seeds is even more effective than saw palmetto berry, which has been shown in head-to-head competition with the leading drug by Merck Sharp and Dohme in this country for prostate enlargement to be more effective. So natural elements can be very effective and very powerful and more effective and a lot safer than conventional drugs. Now cancer, it will actually help in treatment of cancer. And we don't claim this to be a cure for cancer. The body cures cancer. I don't cure cancer. Drugs don't cure cancer. Surgery doesn't cure cancer. Grapeseed extract doesn't cure cancer. It's your body. What this does is strengthen the body. We'll show some slides in a minute how that might help. So that sounds pretty impressive, but it's just a grape. Just remember, it's just a grape. That's simple. It goes back to something as simple as a grape. We've taken for granted. You can't even find grape seeds in the grocery store anymore unless you search pretty hard. When you take a grape and you extract the bioflavonoids from the seeds, you get a powder. This simple powder we put into capsules so that we can have it again. And initially, we recommend taking several capsules a day to treat arthritis, allergies, inflammation, heart disease, as a preventive for cancer, preventive for cataracts, glaucoma. Eventually, if we take a take this and start eating it in our foods, in all these fruits we talked about, you will see magnificent changes in your body, and maybe you won't see anything. That's some of the wonder about it. We hope that you don't see some things. You don't want to see heart disease. You don't want to see cancer. You don't want to see cataracts or glaucoma. And if you don't have those things now and say you don't need it, well, maybe you do need it so that you don't see it. And that's one of the main reasons I got involved in naturopathic medicine is because I believe in prevention. And there are wonderful things that we can do to take charge of our own health and prevent these illnesses that we've thought of in the past as just old age. And maybe we don't need to have these things. This is what the bioflavonoid looks like as we draw it. These are catechin and epicatechin molecules. We know what this looks like. This is not some mystery. This is a molecule that's in the seeds and the skins of grapes. We've analyzed it now in the laboratory, and they are bound together in what we call dimers and trimers, doubles and triples. They're just combinations of these simple little ring structures of carbon and hydrogen and oxygen, and these R1 and R2 are some other little side chains. One of them, called gallic acid, an ester molecule, is only found in the grapeseed. It's not found in the pine bark, and it has been found by Jacques Masquier to be the most potent antioxidant that we know of. It's more potent than the pine bark. So the grapeseed extract has a higher concentration of these bioflavonoids, and it has a more potent antioxidant. These are a spectrophotometric slide of all of the different bioflavonoids and other synergistic compounds that work together to support the effectiveness of this nutrient. I think that God created this for us, not just for flavor, but for our health. And the sweet part is the fruit. The seeds are a little bitter. If you eat them together, you probably balance out. And we should probably be eating the whole fruit. And originally it was discovered to benefit blood vessels. You'll see the bottom slide there, a perfectly healthy blood vessel, and on the top slide we see some cracks or leaks in the blood vessels. One of the things that happens that we hadn't known about before is that it will actually help with what we call restless leg syndrome. I had a patient come to me who had restless legs, and I didn't know what to do for this type of condition until another patient told me it cured their restless legs. So I said, okay, grapeseed extract you can use, because his wife brought him in because he was kicking his wife every night and waking his wife up, and he was getting a poor rest as well. And we prescribed the grapeseed extract, and he was happy to come back and tell me 3 weeks later that he no longer was kicking his wife. She was sleeping, he was sleeping, and his restless legs were cured. Probably the leaky blood vessels allow toxins or other chemicals to seep through into the vascular bed in the leg, which is, when you're lying down, doesn't have the pumping action to get back to the upper part of the body to be recirculated, and so it causes restlessness. His restless legs were gone, and he said, another thing, amazing thing happened. I'd already been to the ophthalmologist when I came to you the first time, and I didn't tell you that, but I had to go back to him because he had to do more tests, because he told me I had glaucoma, and I had a high intraocular pressure building up in my eye. And when I went back to him, he retested it, and he says, excuse me, I have to do this again. And he retested 3 times and found that his pressure was back to normal. He had no more glaucoma. And then I started doing some research, and I found that there is research in Europe that does show that bioflavonoids, these proanthocyanins, actually strengthen the retina of the eye, and therefore prevent this buildup of pressure in the eye that's caused by oxidation and inflammation in the retina. Some more with the blood vessels. If you can look closely around what we call the intimal lining, the blood vessel is a wall, and it's just a few microns thick, but that has a meshwork or a network of connective tissue that holds it together. That a grapeseed extract actually gets incorporated as a food into the lining of those arteries and blood vessels and strengthens them, and it improves the elasticity of the blood vessels. And when you lose your elasticity, your blood vessels get hard, your blood pressure goes up, and that starts the whole cascade of heart disease. It also improves platelet smoothness and prevents their stickiness that causes strokes, which we already talked about. This is a diagram of how the body works to prevent oxidation. Probably at the back you can't see this. Simply, This was in Newsweek last year. Great diagram. A lot of interest in antioxidants because we're finding that the oxidation is so widespread throughout the body and causes so many illnesses. All it is a molecule of oxygen or some other chemical that loses an electron. Electrons, as you might remember from your chemistry, spin around in orbit of a molecule, and they are usually in pairs. If you're a husband and wife in a pair, you can usually harmonize pretty good. If you're like me and my wife's gone and I'm trying to cook dinner, I look like, I'm spinning all over the place. And that's what happens with these molecules. When you only have one, it spins around erratically and bounces until it knocks into body tissues and damages the body tissues. That's oxidation. That causes the same thing as oxidation on our fences without paint. It will cause that erosion. And when an antioxidant comes along, vitamin C or E or some of the enzymes the body produces, it donates an electron to that oxidant, and then it has a pair of electrons, and then it spins smoothly again and harmoniously and doesn't cause damage. This one you probably can't see too well either, but it's a diagram of what happens inside the bloodstream. There are mast cells that are floating throughout our body in the mucous membranes, in the nose, in the gastrointestinal tract that release histamine. You all know of histamine because you've probably taken antihistamines if you have allergies. Histamines are there to fight an overload of pollens. If you walk out into a field and dust is blowing and the pollens are blowing into your eyes and nose, you want your nose to sneeze. You want your respiratory tract to be able to cough up those pollens. You want your eyes to water to flush them out. But if you walk outside and the person next to you does not have any of those symptoms, and your eyes are streaming down, your nose is sneezing one after the other, you're hypersensitive. You have a deficiency of the bioflavonoids that protect that mast cell, to strengthen the membrane of that mast cell to make it normalized. If it's weak, then it overreacts and releases histamine and other inflammatory chemicals we call leukotrienes and serine protease, prostaglandins that cause all this inflammation. And that's why it works in allergies and inflammation. This is some collagen or elastin membranes or a network. They're normally spiral and bound together, and as we age they get hardened and brittle and they don't slide around back and forth, and they get cross-linked. Just like cataracts are normally protein in the eye that has a meshwork that would normally allow light to pass through. As we age, that gets a lot of light through the eyes, and that actually causes cross-linking and causes damage to these tissues so that it becomes thick and you get cataracts. Some drugs will also cause that to happen. This is the slide of the lining of the intestinal tract, the mucous membranes that are protected by the grapeseed extract bioflavonoids. The slide on the left is erosion before treatment. The slide on the right is after treatment. This is what happens with an ulcer. It just erodes that intestinal lining, and it starts to erode all the mucus, and then acid that is in the stomach to digest nutrients causes burning. That causes pain. So the conventional drug treatment is symptomatic. It blocks the acid production. Doesn't make sense at all. I don't understand why it's been used for so long, except it blocks the pain, the patient's happy, but there's no acid to digest any nutrients. So you're not getting food that you normally would get absorbed into your body. So you're going to die of some chronic degenerative disease because you didn't get magnesium that you need. You're going to have some other illness created because you have a nutritional deficiency. So the acid-blocking drugs don't cure the problem, they just stop the pain. You need something like grapeseed extract to actually cure the problem. We talked about cellulite. There really is a difference between men and women. There's more than one, but here's a good one. The connective tissue is different. In a woman, they have deeper chambers of subcutaneous fat, and they don't have as many cross fibers. Like men on the right, you'll see the fibers cross differently. Part of that is so that women can store a little bit more fat, because in the fat some of the hormones are processed, and especially after menopause some of the hormones are processed in the fat. We need that, or women need that, in order to produce their hormones. However, if you get too much fat in there and you You pinch that a little bit, you get dimpling, and that causes cellulite, an appearance that we normally think of as just not too appealing, but it actually is a deficiency of bioflavonoids. We have seen people say that after taking this, they actually notice their skin becoming stronger and the cellulite disappearing. And this is something that shouldn't be thought of as just cosmetic. It really is a sign of a deficiency. This is perhaps the most amazing slide of all. This is a cancer cell, the large one, and the little smaller balls are natural killer cells. These are white blood cells that fight cancer. Now this goes on in your body every day. Our body fights cancer. It knows how to do it. We don't need a new drug for this. The body has the most powerful anti-cancer agents that there are. So the cancer fighting ability is already inherent in the body. We don't need a new drug. But we need to help the cells that are fighting it. The natural killer cells need vitamin C to extend their life. If they don't have vitamin C, they die quickly. It's like a shield. And bioflavonoids also are like a shield that help protect it as it fights it. Now the cancer creeps along connective tissue to metastasize. And the bioflavonoids line the connective tissue and prevent its spread. So in two ways it helps. Another way is it prevents the conversion of nitrites into nitrosamines, which our bodies don't need either. Nitrosamines are found mainly in elements like bacon and meats that are preserved. And the grapeseed extract will prevent those nitrites from converting into a carcinogen called nitrosamine. This has been the most amazing discovery in my practice. And I didn't discover this until a few years ago. Actually, the antioxidant effect was not discovered until 1986. And so we're just beginning to really discover the effectiveness and power of these bioflavonoids. And I've been amazed, as I've said, at my patients as they've come back and told me their stories about what it's done for them, and they are teaching me. So I would like to hear from some of you who have stories first that could tell us what maybe you have experienced as grapeseed has helped you. And those of you who have questions, we'd like to answer your questions also. Anybody have a story to tell about using grapeseed extract?
I have arthritis. I have autoimmune problem and connective tissue problem, and I started taking that, and within a week I've been taking it now for a couple of months, but right away, less than a week really, my joints quit hurting. And I thought, I have a lot of animals. I have like 9 dogs and 7 cats, and they're all geriatric, getting old, strays. And I have a white Bichon who has white covering over one of his eyes, and I thought, well, I'll try it on him. The white eye is like half diminished. His metabolism has always been real slow, and he actually jumps up now for breakfast. I mean, it's like a miracle. It really is. So I know those two things, that it's working. I don't know what else it's doing. I have varicose veins, so I'm hoping it's going to help on that too.
You're welcome. Well, thank you for telling us. And probably those varicose veins are going to be strengthened also, as that takes about 2 or 3 months, patients have told me. The dosage, usually you use, starting out, the recommended dose is 1 milligram for every pound of body weight. So for me, I would take 150 milligrams, that's 3 capsules a day for the first week. If I have something that is not going away, that's either inflammation or an allergy, one of the things that we talked about, I would take more. And it doesn't always necessarily depend on body weight. Unfortunately, we have found that it more relates to the severity of the condition and the deficiency of bioflavonoids in your body. A story, I have a 300-pound patient who took 2 capsules twice a day. He took 200 milligrams a day only, and within 2 days his allergies cleared up. He had seasonal inhalant allergies. Another 9-year-old little boy, 60 pounds, had eczema and asthma. I had been treating him for 2 years. We had helped him quite a bit, but the skin had not cleared up. He would scratch himself during his sleep every night until he would bleed, and all his bed sheets were stained, and his mother would put cortisone cream on him every night. Nothing would get rid of the eczema. When I discovered grapeseed, we decided to give it to him, and we gave him 2 capsules twice a day. Nothing happened. 3 capsules twice a day, nothing happened. I said, I know this will work. Give him 3 capsules 3 times a day. Within a week, his eczema cleared up. He stopped scratching at night. He's no longer bleeding. They don't have to use cortisone cream anymore. And his mother is selling this everywhere she can think of, or telling people to buy it because of what it has done for him. So the dosage can vary. And in this case, a 9-year-old doesn't need to take 3 capsules 3 times a day the rest of his life. He's able to reduce that back after a few weeks. And I usually say wait till the symptoms clear up and then reduce it down to as low as you can go and still be symptom-free. And that may be 2 capsules, maybe 3. You have to see what it is for you. Can you get toxic from too much? The only side effects that have been detected over 40 years is a little bit of upset stomach in patients or individuals who have sensitive stomachs. If you ate 4,000 grape seeds without eating a meal, you might get an upset stomach. It's a little bitter, and the bitter principle can make your stomach upset. Most people don't have a problem with that, and if you take it with food, you certainly shouldn't. It's possible that you could be allergic to the grape seeds. If you're allergic to grapes, that's very rare. I have never seen that yet either. Question here? Food allergies also. Any type of allergy. The food allergies happen, of course, in the intestinal tract, but you have those same mast cells that release the allergic chemicals, and this helps to stabilize those mast cells and prevent that allergic reaction. And they also inhibit histamine, the production of histamine. Most antihistamines actually just block histamine. Once it's released into the bloodstream, this will actually reduce that over-secretion. Question here? Increase the dosage until his pain and his allergies go away. 3 capsules twice a day. If that doesn't work, 3 capsules 3 times a day. And the highest I've ever given was 3 capsules 6 times a day in a patient with severe seasonal allergies. She had intractable allergies, Seldane, nothing was working. She carried a box of Kleenex with her everywhere she went. She was miserable. She couldn't see. She couldn't think. And it took 6 times a day, 3 capsules, 6 times a day. And that took her when she got up to that, it only took a couple of days to clear up. And then she came back into my office, and I said, how are you doing? And she says, you wouldn't believe it, I have forgotten to take my grapeseed today. I'm feeling so good. And she didn't have any symptoms. So after you build that up in your system, then you don't need to take it. Take so much you can reduce it. It would definitely be of help in any type of itis. That's inflammation. Okay?
What experience have you had with hives?
Yes, I've had experience with hives. Hives is usually related to histamine release, and it definitely inhibits histamine production. So it will work with reducing subsequent histamine release. It won't work for the histamine that's already been released. Once you get hives, you have histamine that's already been released into the bloodstream and into the skin. So until that hive goes away, which may take 3 to 7 days, you might have some symptoms, but it'll prevent it from recurring. Somebody back here want to tell us a story?
I started taking the grapeseed a few months ago, and I ran out of it and didn't get any and quit taking it. And I thought, well, I wasn't really noticing anything. But about a month after I had been off of it, I started noticing I was bruising a lot easier, and that's why I'd been taking it. The number one reason is to control my bruising. But that was my thing, is that I really did notice an effect on that. And then my mother has autoimmune deficiency too. She gets bronchitis all the time. She gets the slightest sickness, and she's been taking it. She said in the month that she took it, she has not had one attack, and that she is breathing better than she has in years, and that she just feels 1,000% better. She can't even believe it. She is not even worried about getting around anybody with a sniffle now. So she's really thrilled with that.
Thank you. Question here? Well, that's a very good question. Should you reduce the amount of other nutrients, antioxidants like vitamin C, E, beta-carotene when you start taking grapeseed? I don't think so. And the reason is we need all the help we can get. These work together. They are synergistic. Grapeseed extract bioflavonoid helps vitamin C do its job and be more effective longer. And we know that studies show that vitamin E will reduce heart disease by 45%. That's not 100%. So let's add something to it instead of reducing it. No, blood thinners, that's a misnomer. It doesn't really thin your blood. It makes your platelets less sticky. That's exactly what this does. And Coumadin is a drug that is used as a blood thinner. It just makes the platelets less sticky, but it also can make you bleed to death. The grapeseed extract will do it more effectively because it not only makes the blood platelets less sticky, but it prevents the oxidation of the cholesterol, and it actually will improve the elasticity of the blood vessels and reduce the blood pressure, which shoots that sticky platelet up into the brain that causes a stroke. I want to hear another story. Can somebody tell us a story? My mother will tell us a story. I learned a lot from her.
When he was 14, he was telling me what to eat and drink. So, he's been straight down the line ever since of what we should what we should eat and drink. And he's just been very strong on nutrition ever since. And he's just helped our family so much. It's incredible. He knew when he was growing up that I had arthritis in my hands. I've never liked fruits or vegetables. I've never eaten very many bioflavonoids. And you can see my hands, we had it in our family, but my hands are definitely deformed. And they were getting worse. My thumbs began to hurt so much that my husband was having to button my blouse. It's ridiculous. And my skirts, I couldn't do anything with them. And every place I'd go, I had to have help putting on my clothes. And I could see that television with the old women, and I thought, that's ridiculous. That doesn't hurt that much, that doesn't really, and I'm not that old. That's not going to happen to me. Well, it was happening, and it hurts. I couldn't even push the toothpaste out with this thumb. It was so sore. It was awful. So Clark said, Mom, this has been in France for 40 years. It's just coming to America. You need this. And so I took the grapeseed extract, and in 7 days, it took me 7 days, no pain, no deformity, nothing in my thumbs. It's the greatest thing that ever happened. It took it out of my shoulders and out of my knees. My knees hurt as we were going up the stairs, and Clark's dad, the same way, was saying, oh, our knees hurt. We're going up the stairs. So in 7 days, that was gone, and it's not returned. We don't have it at all, any more arthritis. And another thing, itching. My back itched so bad I couldn't stand it. It stopped all the itching of my skin. And I don't know if that's because I'm getting oil to the skin or what happened, but it just made a really big difference in my skin and in my jumpy legs. No more jumpy legs. So that's the mother's story, and it was wonderful. What a good boy, huh?
Now, my mom looks young, and she looked young before she started taking this grapeseed extract. But it actually started, she told me, to fade her age spots. That amazed me. Age spots, we know why this works now. They're caused by lipofuscin. That is a pigment that is caused by oxidation. It's a fat in the skin that gets oxidized. And when that happens, it creates a pigment in our skin. And our cells in our body are being renewed every day. We're getting new cells replacing the old ones. And so these will fade as new cells come in to replace them, and these age spots actually go away. Amazing. Question? Raisins probably won't work at all. Which would you rather have a skin look like a nice, healthy grape or like a raisin? Why does a raisin look like that? It's left out in the sun, right? It gets oxidized. All the proanthocyanins are used up. They fight it off as long as they can, and then eventually the whole grape collapses and wrinkles up. That's what's happening to our bodies. I have seen it work in asthma in older children. I have a lot of patients 2 years old who I treat. I can't think of an asthma patient that young, but the 9-year-old I talk about had eczema and asthma, has not had any asthma breathing difficulties since he's been on the grapeseed, and he had to go up to 3 capsules 3 times a day in order to cure that. A 2-year-old, usually I don't give it to children because they have plenty of elastic tissue, real soft skin and joints and blood vessels. But if you have asthma, a child needs it. They need more than the average child that age. And it is anti-allergic. Asthma is caused by allergies. Foods mainly, inhalants secondary, so you need to find out what foods your child's sensitive to or allergic to, and you need to eliminate those foods. Now the most common ones are dairy, wheat, corn, soy, peanuts, anything with food coloring in it. saturated fats. Don't give them any of those foods. And they'll probably get better, and that may cure them. The grapeseed will help prevent the allergic reaction, and it would definitely help. I would definitely give it to a 2-year-old, and you have to open it up and put it in applesauce or something. And with asthma that bad, I'd give 2 capsules twice a day to a 2-year-old. Won't hurt them.
I have a story about grapeseed. I do part-time retail, and I'd work an 8-hour shift. And when I'd wake up the next morning, I would get out of bed and literally go like this. I would be so stiff and ache in my hips, and I have spurs in the arches of my feet. And my husband would look at me and say, "My word, you are walking like your 85-year-old mother. What are you going to be if you make it to 85? And I said, "I don't know." I went to a doctor because I started limping, and he stuck me on all these anti-inflammatories, which were just really playing havoc with my stomach. And so I thought maybe I was going to have to give up my little part-time job, which I love because it gets me out of the house. And Darlene, who is an acquaintance of mine, mentioned about grapeseed, and I said, well, I will try it. I'll give it a try. I gave it a try for 3 months. I said, I'll give it a good try for 3 months. I worked a 10-hour shift yesterday on my feet and didn't get away from the store because we were doing a sale until 11:30 last night. Popped out of bed at 6, went and worked another 8-hour shift. I would be so stiff I couldn't walk up to the podium, and before I did grapeseed. I'm totally sold on it. My husband his golf game was affected, and that's his number one love in life, is his golf. And he saw what it did for me, and if I start to even get a little low on grapeseed, he said, I need more grapeseed, because it has totally cured his hands so that he can play golf. I am just really sold on it. Thanks.
Thank you. My grandmother was not able to get out and go anywhere until she started taking the grapeseed. She had to stop going to church. Nobody saw her. She was really depressed because she was not able to get out and move around as she had used to. Any other questions? Yeah, once a stroke has occurred, will the grapeseed still be a benefit? Yeah, it's going to prevent the next stroke. If they survive that stroke, you want to definitely do something different. And the grapeseed extract will help them not only heal the damage, we know it heals scar tissue, it will probably help repair some of the damage, but it will prevent the next stroke, which may be fatal. Our time is really gone, and so I think we'll end it here, and we appreciate everyone's coming. We're going to make a copy of this tape, which will be available so you can give to other people if you would like. And I've written a booklet that'll be about 20 pages long, and so that'll be available also. Thanks for coming. Appreciate it.